All right, so let's go ahead and get started here. My name is Andrew Young. I'm a physical therapist with iMove. I've been with iMove for about 6 years, and I'm really excited for you all to be here with us tonight to talk about knee and specifically knee pain, what the causes are, and then what you can do about it to start feeling better. So we'll go over a little introductory information here first, just a little bit about me. As I said, my name is Andrew Young. I'm a doctor of physical therapy and an orthopedic clinical specialist. I've been with iMove for almost 6 years now. You can see in the pictures, it's my wife, Kylie, and I when we were out hiking in the Canadian Rockies. A beautiful trip. And on the right side of your screen, you'll see my new daughter, Lucy. She is 5 weeks old, and it is already flying by, as I'm sure all of you know. Time with your kids goes so fast, and I'm already feeling that. Anyway, she's great, and just like growing super fast. So why are you here? I'm guessing that you're here because you or somebody you love has knee pain and you would like to get rid of it. Um, isn't that why we're all here? Is so we can participate in activities we love, so that we can participate with family, recreation, without being limited by pain that we might feel. So I want to start off here by asking, what is your story? Has your knee pain been around for a long time? Is it relatively new? Is it Does it seem to be progressing and getting worse? Does it seem to be staying about the same? What activities for you really seem to be aggravated or aggravate the knee pain? And then what activities seem to relieve it? But really, the key question is, what is your story and what brought you to this place where you're seeking this new information? Um, Before we go any further, I also want to mention I have a colleague in the video with me, Jeff Clark. He's another physical therapist with iMove, and he's going to be monitoring the chat feature during our Zoom call. So if you have any specific questions or anything that you want to share about your knee pain, your experience about knee pain that somebody you love might have, please feel free to engage with Jeff in the chat. He'll be reaching out to you. And at the end, if you have any questions or if there's anything specifically that you want to talk about, Jeff is going to hop on the call with me, and we'll have a little discussion Q&A section about things that you specifically are interested in. So please engage with him and let him know what information you would like to learn and what questions you might have. So how do you know if you're in the right place? Well, number one, you're in the right place if your knee pain is reproducible. What that means is, can you specifically correlate your knee pain to specific activities? Typical activities that we hear a lot in the clinic are listed below. Knee pain with walking, maybe it's standing, maybe it's squatting, maybe it's gardening, maybe it's watching your grandkids. But if you can correlate your knee pain to a specific activity, then you're in the right place. You're also in the right place if you've tried to manage your knee pain on your own for a little while, or maybe you've tried to alter it through heat or ice or ibuprofen. Maybe you've tried some stretches. But if you've tried to manage it on your own in the past, and if you have interest in continuing to try to manage it, you are in the right place. And as you can see there on the bottom, the goal here is to change the knee pain, to improve, to let your body heal. The third thing that lets you know that you are in the right place is if you desire to treat the dysfunction instead of the symptoms. Now, what do I mean by that? The symptom, I would say, is the pain that you feel. And even more specifically, the symptom could be coming from some damaged tissue in your knee, whether it's arthritis or a meniscus tear or a sprain. The symptom is the pain. But we also need to go a level deeper and try to figure out, well, why is the pain there to begin with? Maybe there was an injury in your past that potentially there's some tissue that's been injured from a specific moment. There's also plenty of people that have knee pain that really they can't pinpoint a specific time when it came on. but it's just slowly progressed over time. And in those scenarios, we need to do more than just look at, exactly where the pain is, but we need to look at how your body works as a system to see and answer the question, why is this knee pain here to begin with? Here's a fun Albert Einstein quote. It says, "Insanity is doing the same thing over and over again and expecting different results." If you have been managing and trying to change your knee pain for maybe it's a few days, maybe it's a few months, maybe it's a few years, and it's just not getting better, it's not improving, then it's time to maybe do something different and look for a different result. And that's something that we can help you with and trying to figure out what the right next step might be. And part of that right next step could be talking to a clinician at iMove. Just as a thank you for participating and being here with us today, everybody who is in attendance will receive an offer for a free one-on-one assessment and consultation with an iMove clinician. Basically, this is no strings attached, totally free. It's a 30-minute one-on-one session with one of our clinicians where you'll have an individualized assessment and a treatment plan specifically for you and for your situation, trying to figure out what the next best step is for you. So stay tuned, and at the end, I'll tell you how to claim that offer for the free complimentary consultation. So talking about our bodies and how they work as a system, and treating the dysfunction and not just the symptom, it's kind of helpful to think back about sort of my own individual aha moment when I realized that our body really, it's not a bunch of isolated parts, but our bodies work together as an integrated system. When I was in high school, I had a really significant ankle sprain. I was playing basketball and I jumped and came down on somebody else's foot and really sprained my ankle bad. I mean, swollen up like crazy, bruised like crazy. Thankfully, I had a really great, skilled athletic trainer who I went to after the injury, and he did a couple of things. Of course, he's managing the symptom. He's trying to decrease the swelling, trying to restore range of motion, to decrease pain. But he also did something really interesting. Is he said, "Andrew, before you leave therapy, I want you to stretch your hip out for a little while." And of course, me, I said, "Well, why in the world do you want me to stretch my hip? It's my ankle that's the problem. Don't you know what you're talking about?" And he said, "No, you need to think of the body as a system, and the way your hip moves can affect your ankle and vice versa." So I said, "Okay, I trust you," and went ahead and stretched my hip. And lo and behold, after I stretched my hip and freed up some range of motion, my ankle actually did feel a little bit better when I was up and walking around. So it was just kind of my first introduction to how this body kind of works as an amazing system rather than a series of parts. So that's kind of started out my interest in human movement and studying human movement, which led to a really long journey for me. I'm a Hope College graduate. I studied exercise science. From there, I earned a doctor of physical therapy degree from Elon University down in North Carolina. Went on to become a specialist in orthopedic physical therapy, internships and clinical rotations at Duke University Medical Center, Wake Forest Baptist Health. So it's kind of kickstarted me on this journey of learning about really how amazing our bodies are, how our body is an integrated system, and also how amazing our bodies are at healing and adapting. So let's get into some of the meat of our presentation today. So here's what we're going to learn. First, the first section is going to be a discussion on the 3 most common types of medical diagnosis that causes knee pain. Number 2, we'll talk about the 3 most common dysfunctions that can drive knee pain. Number 3, we'll talk about the 3 best ways to start treating your knee pain. So let's get right into it. The 3 most common types of knee pain that we see in the clinic. Number 1 is arthritis or joint degeneration. Number 2 would be sprains and strains. And number 3 would be cartilage or meniscus degeneration. So let's talk a little more in depth about arthritis or joint degeneration. It's really common. 90 to 100 million Americans have knee osteoarthritis. But the really interesting thing here is that you can have knee arthritis that shows up on an X-ray or an MRI, but might not actually be painful. So if you look at the statistic right underneath the 90 to 100 million Americans with osteoarthritis, only about 10% of them for males, 13% for females actually have symptoms. So again, you can have knee pain that shows up on an X-ray or MRI, or knee arthritis that shows up on an X-ray or MRI. That doesn't necessarily mean that you have to have pain associated with it. Arthritis is more common in people who are overweight, have diabetes, or have heart disease. The prevalence of knee arthritis and knee pain has led to just 600 to 700,000 knee replacements each year. There's a variety of risk factors that could predispose you or put you at a higher likelihood of developing arthritis or joint degeneration. And that includes injury, your age, gender. Women over 50 seem to be a little more likely to develop arthritis. Being overweight, genetics are a component. And interestingly, also race seems to play a role. There are some ethnicities that have a decreased likelihood of knee arthritis than others. So a question I get all the time is whether it's knee pain or related to the shoulder, the lower back, or some other part of the body is, can it be healed? If I've had an X-ray, the doctor has confirmed, yes, there is arthritis in my knee joint. What on earth is physical therapy or stretching, or what is conservative treatment going to do to fix the arthritis in my knee? It's arthritic, right? But I want to point the discussion back at this point to the idea that just because you have knee arthritis on a scan doesn't mean it has to be symptomatic. I'm not going to sit here and tell you that physical therapy heals 2 or 3 decades of knee arthritis or joint degeneration. But what I can say is that conservative treatment, and the research backs this up, it has the ability to change knee arthritis or degeneration from a symptomatic or painful knee arthritis to an asymptomatic knee arthritis or pain-free knee arthritis. A key concept here is that when you reduce friction, you can decrease inflammation. The idea that motion is lotion is helpful here. Inside the knee joint, there is fluid which lubricates the joint surface and allows the knee to glide really nicely. When you have arthritis or degeneration, you can have more friction over time because those bones aren't gliding well, which can lead to pain. So that covers knee arthritis and degeneration. Another common type of knee pain that we see in the clinic would be sprains and strains category. A sprain would be a ligament issue. So common major ligaments of the knee are the ACL, the PCL, the MCL, which is on the inside of the knee, and the LCL, which is on the outside of the knee. Sprain is more of a muscle issue. So at the knee, we're talking about typically the hamstring, maybe the quadricep muscle. You can also have some IT band irritation at the outside of your knee that could potentially be in the strain category. The strain injuries are more common in elite and recreational athletes, but it's certainly not exclusive to those groups. I've seen plenty of people who have strained a muscle or sprained a ligament because of a slip and fall on the ice in Michigan, as an example. There are a lot of ligament injuries that happen in the U.S. every year. Again, it's pretty common. About somewhere between 80 to 250,000 ACL tears happen in the U.S. alone. That is a lot. I'm sure you've heard about the ACL and how it's important for athletic function. Lots of ACL reconstructions are happening every year. That would be in the sprain or the tear category. Your MCL, which is a really important ligament sort of on the inside of your knee, towards the middle, it's pretty common with athletic injuries. And because of the blood flow that exists in the MCL, it's one of the few ligaments in the knee that can actually heal. Blood flow is really important for healing. If you don't have great blood flow, then it limits your capacity to heal. But the MCL does seem to have some blood flow, which can allow that ligament to heal better than others. The last big ligament would be your LCL. It's the least common ligament of the knee to be injured, but it does happen, and that is a big ligament on the outside of the knee. The third type of knee pain I want to discuss today is cartilage or meniscal problems. Meniscus issues, whether it is maybe some fraying or a meniscus tear, it's really common. It's the second most common knee injury. Also, it can happen along with an ACL injury. I see lots of adults or kids who have had an ACL tear and also at the same time suffered a meniscus tear. Meniscus repairs account for quite a bit of orthopedic surgery in the United States. 10 to 20% of all orthopedic surgery in the US has to do with the meniscus. So it's very prevalent, and meniscal tear can cause pain or clicking. Also, cartilage issue or degeneration in the knee, that also can be painful and cause inflammation. Cartilage problems are also pretty common. They're found in about 60 to 70% of all knee surgeries. The important thing to remember about cartilage damage or meniscal tears is it's similar to the arthritis discussion that we had earlier, is that you can have some degeneration or some cartilage some knee cartilage issues. You can also have some meniscus tears that really aren't painful. They're finding some meniscus tears and cartilage issues in people that have no pain at all. So I think that is good news. If you have a meniscus issue or you've been diagnosed with a cartilage issue, that doesn't mean that the meniscus tear has to be permanently painful. There are some situations when, even if the meniscus tear is still present, you can rehab and make sure your body is working well as a system. And then that meniscal tear or that cartilage issue that was bothering you previously is no longer painful because your body is working well as an integrated team. So lesson number 2, we talked previously about the most common medical diagnoses for what might cause knee pain. But now let's talk about the 3 most common causes or sort of drivers of knee pain. And this is really where we specialize in physical therapy, is looking at the body as a system. So we want to look at how your hips move, we want to look at how your feet move, and we want to look at how your spine moves. Because when you walk or when you use stairs or you're gardening outside or when you go for a run, your body is working as a system. It's not just isolated knee movement. So we need to make sure that your feet, your hips, and your spine are all working together to try to take some pressure off of the knee joint. Our body works as a system, like I was saying earlier. We need to have a combination of mobility, which would be flexibility at the hip, the knee, the foot and ankle, along with stability, which is the strength component. We need to function well. We need to have the strength to move in and out of big ranges of motion. And when we lack either strength or flexibility, that can predispose vulnerable areas to our body to taking extra load and extra work. If you look on the upper right-hand corner of the screen here, there's an X-ray picture that I put in. This picture I really like because you can see the shin bone, that really long bone in the X-ray, and at the top you can see a space, that's the knee joint, and toward the bottom you can see some other bones, and that's the ankle. But in that picture you can clearly see that the shin bone, it's called your tibia, is part of the knee and part of the ankle at the same time. So when you look at that, it's intuitive to say whatever is happening at my ankle is going to affect my knee and vice versa. The knee design, it has quite a bit of bending and straightening. That's the main function of the knee. It's kind of a hinge joint, bending and straightening, but it also has a little bit of rotation to give. It also has a little bit of side-to-side motion at the knee joint, but it's relatively minimal. The main motion of the joint is to bend and then extend and straighten. But the important concept here is that the body is working as a system. And if you lack some rotational flexibility at your hip, or if you lack some rotational flexibility at the foot and ankle, your knee only has so much to give. It has a little bit of rotation to contribute, but not much. And if you're doing an activity that requires quite a bit of rotation and your hips don't have it, your feet and ankles don't have it, your knee, it is likely to take some extra strain and potentially cause an injury. When I think about a rotational injury, often I think about the meniscus. The meniscus is vulnerable with rotation, so that's why it's important to make sure your hips and your feet and ankles, and your spine for that matter, have lots of rotation to protect your knee. So, what does successful treatment look like? We've gone over the three common drivers of knee pain, the three most common medical diagnoses for knee pain. But what does it look like to actually treat it and decrease the pain and improve? Well, first, it looks like addressing the body as a whole system. We absolutely, if you have knee pain, we should be focusing on the knee and the symptom and trying to figure out what's happening. Is there any damage at your knee? That's really important. But we can't just have our blinders on and only focus at the knee. We have to look at how the feet are moving. You can see this picture is really interesting. The person on the left, there's a little change in the foot. They're a little flat-footed. I see this often if people have had a foot injury in the past. They develop, maybe their arch collapses a little bit on that side, and that can affect alignment at the knee. So we have to be looking at how your feet are functioning. You have to be looking at how your hips are functioning. The example I used earlier is that your hips have quite a bit of rotation to contribute with various activities. But if you don't have good hip flexibility and you're still asking your body to do an activity that has a lot of rotation, golf is a great example, but your hip just doesn't have it, your knee is at risk for potentially developing pain. And another one we don't talk about quite as often, but is equally as important, is your spine. Your spine, especially that middle part of your back, has lots of rotation to give. And so, if you don't move well through your upper back, if you're stiff there, but you still want to play golf or do anything that requires a rotational activity, maybe it's just standing and pivoting to the right to look at something in the grocery aisle. But if you don't move well and rotate well through your spine and your hip, it could predispose your knee to an injury. So let's get into a few more specifics here. Common treatments for arthritis or joint degeneration. If this is you, motion is lotion. It is good for you to move that knee joint. It lubricates the surface. But it's often better to move the knee joint in a unloaded environment. So a good example would be getting in a pool. The buoyancy of the water takes some of the pressure off of your knee joint and allows you to move it, often with a lot less pain. But that motion is still lubricating the joint and bringing nutrition to the joint surface. So some simple exercises to do in a pool would just be walking. Get in a pool and walk in the shallow end. Walk forward, walk backward. Do some side shuffling left, side shuffling to the right. You do some squats in the pool. You can balance on one leg in the pool. All of that is usually pretty comfortable because the water is taking some weight off the knee. Another good example would be hopping on a bicycle. You're sitting on the seat of a bike, so you're not having that same compressive force at the knee that can be irritating, but that circular motion can be really helpful in lubricating the joint, improving range of motion, and decreasing pain. So for arthritis or joint degeneration, unload and move that knee. Another option before I move on is if you have a gym membership, using the leg press machine. Put it on a relatively low weight and then just move your knee in and out. Use the leg press just for some lubrication of the joint. Moving on to sprains and strains. Typically, if you have a sprain or a strain, it happened in an acute incident. Usually you'll be able to remember, hey, I tripped and boom, that's when I had my knee pain, or I slipped on the ice and oh yeah, that's exactly when my knee pain started. If that happened relatively recent, You do need to protect the healing tissue, especially if you're seeing swelling and inflammation. But then it is good for you to gradually reintroduce activity over time. You can't protect that knee forever. Eventually, you need to restore motion, restore strength, restore strength. Um, a good example that I use is for people who really like to go on walks or who like to jog. If you had an injury, it's probably not the best idea for you to go out and walk 10 miles your first day back going out for a walk. It's better for you to slowly reintroduce activity over time. So an example I like to use would be if you are a walker, on the first day, go out and just walk to the next driveway on your street. The day after, walk 2 driveways down. The day after that, go ahead and walk 3 driveways down, slowly adding duration over time. If you're a jogger and you like to run, I like to have people jog in intervals. So jog for 30 seconds, walk for 5 minutes. Jog for 30 seconds, walk for 5 minutes. The next week, if you feel okay, jog for 1 minute, walk for 4 minutes. Jog for 1 minute, walk for 4 minutes, and gradually reintroduce activity over time. And you could apply those principles to any activity you like doing. Just gradually reintroduce them over time. The last category would be cartilage or meniscus problems. Flexibility is so important for meniscus issues and cartilage issues. Your hip and your foot and ankle have lots of mobility and rotation to give. So if you're having, or if you've had a confirmed meniscus issue through an MRI, or if you've seen a doctor who thinks you might have a meniscus problem, stretch your hip out. Do some calf stretching of the foot and ankle. Do some ankle circles. Just get the hip and get the foot moving. That'll decrease some of the rotational motion at your knee and potentially allow your meniscus to heal and become less painful. So in summary, successful treatment is, number one, it's individualized. I think that we would all agree that everybody's a little different, a little unique, and that all of our histories are unique and our bodies move differently. So, YouTube, although it's awesome, that those top 3 exercises for knee pain, they might be good, but they might not be the best exercises for you because we all are unique individuals. Successful treatment should be whole body focused, should be a global perspective. Should be educational and empowering. You should be learning about how to care for your knee and be able to build confidence in your ability to assess and treat your knee over time. Should be one-on-one. When you're with a physical therapist or somebody who's treating you, they should be focused on you and focused on your situation and giving you exercises that are unique for you. And then often the last 2 points, there's often a hands-on component, maybe some hands-on stretching, some movement to decrease pain, along with an exercise component to build strength, build flexibility, and build tolerance for movement. There's so much research out there that supports the use of physical therapy as a sort of a frontline defense if you have knee pain. Surgery is needed in some circumstances. However, in most cases, it would be smart to fully flush out conservative treatment before you rush into something invasive. You can see I listed a few research articles here. The first one talks about arthroscopic surgery for knee arthritis, provides no additional benefit to optimized physical therapy and other conservative medical management tools with your doctor. No benefit, no added benefit. Also, physical therapy combined with manual therapy. So manual therapy is any hands-on stretching or maybe some joint movements that a physical therapist would do for you. Basically, they found that doing some exercises and having some hands-on treatment with a physical therapist together provides you with a superior outcome. In that, if you have about a session a month, you can see really significant improvements in knee pain over time. The last thing I want to leave you with is that you are not defined by your MRI or your X-ray. This little infographic here I think is so interesting. This is based off of a study where they basically took a big group of people who had no pain at all, and they gave them x-rays and they gave them MRIs, and they had radiologists read them just to see what they would find. And in the knee, you can see the orange arrow there on the right-hand side. They looked at 5,397 knees. And in people older than 40 years, they found, depending on the study, between 19 and 43% of them had arthritis that showed up on an MRI, or x-ray, even though they had no pain at all. 43% of people had a cartilage defect that showed up, even though they had no pain and no symptoms. And finally, 19% of people had a meniscal tear that showed up, even though they are completely pain-free. I'm not trying to minimize the importance of MRIs and x-rays. They are important and extremely valuable tools. But what I am saying is that if you have arthritis that has shown up on an x-ray, or if somebody's told you you have arthritis, if you have a cartilage problem, if you have a meniscus tear, it does not mean that it has to be symptomatic forever. You can have those things underlying, but with the right treatment, they do not have to remain painful for the long term, and that you can return to fully functioning, healthy lifestyle, pain-free in a lot of cases. So be optimistic. If you've had an MRI or an x-ray and those things have popped up, your body can adapt, can heal, and can recover from them. So that wraps up our material from the day. For the day, I'm going to bring Jeff in here in a second, see if any questions popped up. Just a reminder for those of you participating, again, thank you for being here. And as a thank you, you are eligible to claim a free 30-minute knee assessment with one of our clinicians. If you look in your email inbox right now, there should be an email from iMove with an invitation for you to claim your free 30-minute session. It could be virtual, it could be a Zoom call with me, just like we're doing right now, or it could be in person at one of our 7 clinics. But it really is a totally free, no strings attached option for you to spend 30 minutes with an expert just for an assessment to try to figure out what might be going on with your knee and how best to move forward. So thank you so much for attending tonight. Please check out in your inbox. If you don't see it in your inbox, Jeff is sharing a link in the chat with you for you to claim the consultation. But I'm going to go ahead and bring Jeff in here to see if any questions or anything specific came up throughout the session.
Andrew, can you hear me?
Yeah, I can.
All right.
Anything come up there, Jeff?
Yeah, there's got an interesting question here about knee replacements. And
Okay.
The question is there any reason to have physical therapy before I have my knee replaced?
That is a really good question, and one that comes up pretty often. I would say it depends on the situation, but often physical therapy before knee replacement can be helpful. One of the things that happens with any surgery, and a knee replacement is included, is that in the recovery process, you lose some muscle mass. And you also move flexibility at the hip, and you lose flexibility at the foot and ankle. So one thing that a few sessions of physical therapy could do for you before a knee replacement would be, to give you some exercises to build strength up before you go in for the surgery itself, so that essentially you're starting at a bit of a higher baseline. And the other thing that would be really helpful would be to give you a few stretches for the hip and for the foot and ankle to make sure those guys are moving really well. So that way, after the surgery, when you are recovering, your foot and ankle and your hip can really fully contribute to try to take some load off of that knee while it's healing. So bottom line, it can be beneficial. And I would encourage you to take advantage of that free 30-minute complimentary consultation, just to talk it over with one of our clinicians. And in that situation, they can go over a few exercises with you, or at least set you off on the right foot before your surgery. So yes, it can be helpful.
Okay, next question. Also, pretty well related to this. I never understand how strengthening helps inside the knee. Doesn't that just increase the grinding inside my knee?
Yeah, super good question. Grinding inside of the knee can be caused by several different things. One thing that can cause grinding is degeneration. The other is sometimes a meniscus tear can cause either clicking or popping or catching. Basically, what strengthening does is it allows you to control the knee joint a little bit better as you move in and out of different activities. There was a slide that we went through earlier that showed that person with a collapsed arch where the foot is a little bit flat, and it changed the alignment of your knee. Um, and that alignment change can cause compression actually on one side of the knee compared to the other. Um, so it's important from a strengthening perspective. If you have a little bit of extra motion at the knee, maybe because your foot has collapsed over time, or if you have a meniscus issue causing grinding, um, strengthening can help you control the knee motion and potentially decrease some of that irritation over time. So super good question.
Okay, and it looks like the last one that we have for now in the chat is from a Sue, and this question is related to her granddaughter who had an ACL tear.
Okay.
And she's wondering what kids her granddaughter's age can do to prevent the ACL injuries. Is there anything that can be done?
Great question. The answer is yes, there is something that can be done. They've actually done a lot of research on this. ACL is a pretty hot
Has the
topic.
rain
I'm
kind
sure
of subsided?
you're very aware of it. But yeah, basically, what they've shown through some research over time is that doing some strength training, and there are specific types of strength training that can actually be really preventive and decrease the incidence of ACL tear by quite a bit. I've seen some research that says even up to about a half to a two-third reduction in the risk of tearing the ACL with some specific strength training and also some plyometric exercise, which just means jumping and some more powerful control movements. So if you are concerned about a granddaughter, a nephew, a niece, or somebody that you love and you want to decrease their risk of an ACL tear, there are things that you can do. And consulting with one of us at iMove would be a really great idea to set up some exercises for the granddaughter, the niece or nephew to help decrease that risk. But yes, strength training is protective for the ACL.
Okay, great. That's all the questions we have, Andrew.
Okay.
And I guess in order to stay true to the time that we have set up, we can probably end. Your presentation was 30 and your Q&A was 10, so that's great.
All right, sounds good. Well, thank you again, everyone, for attending, and please feel free to take us up on that 30-minute session. We would love to see you and help you start healing. So thank you. Have a good night.